On September 7th, we intend to allow entry for fully vaccinated travelers from any country for non-essential traveler. Travelers will have to be fully vaccinated with a Health Canada authorized vaccine at least 14 days prior to entering the country. But ahead of that date, on August 9th, a number of important changes at the border will come into effect to allow fully vaccinated United States citizens and permanent residents who are currently residing in the United States to enter Canada for non-essential purposes. The same requirements will apply. Travelers will have to be fully vaccinated with the Health Canada authorized vaccine at least 14 days before entering the country. Our approach at the border has always been based on the latest science and evidence. This approach will be, the relaxation of measures will be a gradual process, taking into account the vaccination rate of Canadians and our own epidemiological situation. All travelers, regardless of vaccination status, will still need a negative pre-departure test. However, starting August 9th, we will shift to a mandatory randomized testing for fully vaccinated travelers. So only those that have been randomly selected will need to complete a day one test. This shift allows us to focus efforts on unvaccinated travelers while still keeping track of new variants.
Canada announced it's going to reopen its borders for U.S. citizens who are vaccinated on August 9th. Does the United States plan to reciprocate?
We are continuing to review our travel restrictions. Any decisions about reopening travel will be guided by our public health and medical experts. We take this incredibly seriously, but we look and are guided by our own medical experts, and not in a I wouldn't look at it through a reciprocal intention.
When we look at the number of people in hospital with COVID, it's a somewhat different picture. So the first peak, second peak, you can see clearly, and then on the right-hand side, you can see that the number of people in hospital is increasing. So it will increase because of the infections, but not as far as it did before, and that is because of the protection of the vaccines. So we do expect this number to increase. We do expect there to be over 1,000 people per day being hospitalized with COVID because of the increased infections, but the rate should be lower than they have been previously because of the protective effects of vaccination and the real importance of making sure that everybody gets vaccinated. We are seeing an increase in the number of deaths, but at a much, much lower level, but they again will continue to increase as infections increase and will be expected to reach over 100, possibly a lot over 100, but we'll see an increase in deaths over the next few weeks as the infections rise, but at a much lower level again because of the protection of vaccination.